Hi, my name is Barb Phillips. I'm a lymphedema nurse. A lymphedema is when you've got a poor transport capacity of lymph, and it's often caused by people who have had cancer-related surgeries. However, you can have lymphedema in any part of your body. So there's two types of lymphedema, one's primary and one's secondary. The secondaries are the ones with, where there's been surgery and you may have had lymph nodes removed. So the lymph system is like a drainage system, and if it doesn't flow properly, it backs up and collects in the tissues and you get a swelling. So the obvious one for, say, somebody with breast cancer, it would be a swelling in the arm, because they usually take the nodes from under the arm. People can come and see me when they've just had surgery, or prior to surgery is better, particularly for breast cancer, for instance. So the bioimpedance machine picks up the amount of fluid that's in the tissues, and so it can detect changes before we even know they're there. So in that instance, it's really good to have a test done prior to surgery, because we get a baseline for that. After surgery, we can still get that baseline and then go on from there and do regular monitoring of that. So it's like a surveillance. So that's a preventative sort of measure. If people are noticing that they've had surgery and they get some swelling in their hand or their arm, again, or in their legs, it can be in their feet, that's certainly important to get onto that early, because lymphedema never goes away. It's not curable. It's something that just increases over time very, very slowly, and before you know it, it can make it quite significantly difficult for that person to have a good quality of life if it gets away, from you. No, people come to me. I work on a Wednesday in Bairnsdale, and at this stage, we would do an assessment to begin with, just to see where things are at and what they want to achieve out of their visit, and then we work out a treatment plan from that. We can do different treatment type options. So there's exercises, there's manual lymphatic drainage, which is like a massage, and compression is probably the main one that will get a really good outcome for people fairly quickly. Just the interaction with people and being able to help them, yeah.